All right, welcome back to part two of our research ethics PowerPoint, our the lecture. So let's go into some of the assessment of risks and benefits in psychological research. So risks in psychological research: physical harm, psychological stress, loss of privacy, and confidentiality. Now, we have to part of designing a study and if you have participants getting it approved by the IRB is weighing the the cost benefit, risks versus potential benefits, right? And when an IRB looks at a study, they're going to really make this determination of, do the risks outweigh the benefits, or do the benefits outweigh the risks? And if I'll tell you now, like a study like the Stanford Prison Experiment, there's no way that an IRB, even if there's really great benefit, they would say that the risk to participants is too great, uh, and there's no way you can justify the benefits based on that amount of risk. Um, it'd be like, you know, it'd be like jumping off a cliff, right? It's thrilling. I'm sure it'd be incredibly fun for a moment, but the risk of that doesn't outweigh the benefit, because the risk is mortality, the risk is death. And so that will never, it will never outweigh the benefit, or it'll never, the benefit will never outweigh the risk. And so when we think about benefits, we think about a new skill, treatment for a psychological or medical condition. We see this a lot in medical research, where there's experimental treatments that do that do have the potential to cause harm to participants. And so those studies, if you've ever seen somebody that's been a part of them, those have gone through rigorous analysis by the IRB and had to have been approved in, and the IRB would have said the benefits of this treatment outweigh the risks to participants, right? So a quick flowchart, you know, do the potential benefits of the study outweigh the risks involved? This is basically what every IRB is the question they're gonna wrestle with. Here, let's advance. Now, one of the most important parts of an ethical study is informed consent. It's a document that's signed by participants, affirming that they have been told the basic outlines of the study and are aware of their participation will involve. They have to know about the risks, that their participation is voluntary, and most importantly, that they can stop at any time, no questions asked, and that they required to be debriefed, especially if there's deception in a study. And I'll tell you right now, um, I was at one time I was creating a study that had a little bit of deception in it, because we thought that if participants actually knew the exact nature of the study, that it would affect the results. And when we submitted it to the IRB, the IRB is like, absolutely not. Like, you need to have a much better justification for why deception is authorized and why deception is necessary in this study. Also, you have to have a very detailed debriefing plan for participants. So, in the wake of all of the unethical studies that we've talked about before, the IRB tends to be really, really stringent, especially if it's a part of like a research hospital. Like when I was doing that, that was a part of UCSF. And so I was trying to do some research on some digital mental health interventions. And so IRBs at those types of institutions tend to also be very, very stringent, especially if they're an educational institution. Um, the reason debriefing is so important is that it has to take place after completion of the study. It's an opportunity for the researcher to deal with issues of withholding information and potential harmful effects of participation. Even the fact that somebody's been lied to, that you said I was doing this and that was actually a lie, that can cause some distress in someone, and that's why deception is such a high bar for the IRB, is because we want to do our best to not cause undue distress on a participant. Really, the briefing also says, hey, this is why it was necessary. At that time, we'll also provide additional resources like mental health resources. Like, we're responsible for connecting folks that are distressed to therapeutic resources. It also makes sure the participant leaves the experiments without any ill feelings toward the field of psychology, that they're taken care of, that things are explained to them. Now, the types of participants that we tend to go after in research are college students. College students probably comprise the absolute majority of research studies, especially if it's coming from an educational institution. And it's also a reason for a significant amount of critique, because it says you're basing the generalizability of results based on a population that may or may not be reflective of everyone else in the world. Not everybody goes to college. Not everybody is a college, has been a college student, and so how can you say that your results are applicable to everybody when it really seems like it only applies to this population or this sample? Now, I boldened these other groups, so children, prisoners, minority groups, disabled populations, because those are protected populations. If you're going to have these these populations in your study, you have to take extra measures of protection. So when I was at UCSF, I did some studies that involved kids under 18. So we looked at kids that were sort of in their later teenage years, around like 13 to 18. 13 to 17 was really the sweet spot that we were looking at. And what we had to do was the children themselves had to sign an assent. We also had to get parental consent. And if we had only one of those two, we couldn't include them in the study. Like, we would not be able to allow them to participate. Prisoners, because of the risk of coercion. Disabled populations, because of any risk of not fully understanding the risks involved. Any group that I might be cognitively impaired or cognitively vulnerable is requires, like, we just want to make sure that they know, the research participant has to know exactly what they're going to encounter. Now, animals are a different issue. That's why they're bold and italicized. And I'm going to talk a little bit about the animals used in research in a few slides. So the Institutional Review Board, I talked about it pretty at length in the prior slides, but they are responsible for reviewing research. They determine whether your research goes forward and whether it does not. Oftentimes they'll try and work with you, because I've submitted a number of studies to the IRB, and usually they'll come back with, like, hey, we have questions about this. We need you to expand on this. We need you to provide more information about this, and then you can resubmit. And you continue to resubmit until they're satisfied that the risk to participants has been effectively minimized. All research conducted by students, faculty, and staff must be reviewed. It has to go through this process. And there are different types of process. So there's exempt research, where there's no review needed, but even still, you have to submit it to the IRB, even if exempt research, for them to say, okay, yeah, that's fine. We realize that there's no review needed for this. And exempt research is, I'm trying to think of an example, is pretty pretty few and far between, especially if you have research participants. Like, don't count on ever having exempt research from the IRB. Where this comes into play is like if you're looking through treatment records or medical records where you're actually not interfacing with the participants, and oftentimes that type of research will be exempt. Minimal risk research, when the risk of harm is no greater than the risk encountered in daily life or routine physical or psychological tests. So this includes like your surveys, um, stuff that's really kind of low impact to a participant, but the IRB still reviews it. They still have to do a routine review, and then there's greater than minimal risk research that's thoroughly reviewed by the IRB. And a lot of times this often applies much more in medical research where there's invasive procedures to participants. Less often, I guess, in psychological research, unless you're using deception or unless there's something that's really intrusive or invasive to a participant. And maybe that might be sort of having a patient in an inpatient setting and having them go through either like residential treatment or inpatient treatment. That's usually going to have a greater than minimal risk, especially if the population is a bit vulnerable to that, if there's, the folks with like severe mental health challenges. Now, the Belmont Report led to the development of the Ethics Code. I'm going to say that again. The Belmont Report led to the development of the APA Ethics Code. You may need to know that in the future. So there's 5 principles: beneficence, responsibility, integrity, justice, and respect for the rights and dignity of others. Now, these 5 principles are also a part of additional 10 ethical standards that address specific issues concerning the conduct of psychologists in teaching and research and therapy and counseling and testing and other professional roles and responsibilities. Now, the 10 ethical standards are 1, resolving ethical issues; 2, competence. And when we talk about competence, that's basically like your knowledge base. Like, so for example, I specialize in trauma treatment and the treatment of families and couples. So, anything that's outside of my competence, I'm not allowed to practice in. So, for example, if I were to see somebody with an eating disorder, I'm not really well trained in eating disorders, and so my best course of action would probably be refer folks out rather than practice outside of my competency. Now you can get training and become and develop your level of a competence, but if you don't have it, the general rule is that you don't practice. There's also standards for human relations, privacy, and confidentiality. It really sets the stage for how we maintain and protect privacy and confidentiality of our clients, of our patients. There's rules about standards for advertising, record keeping and fees, education and training, research and publication, assessment, and therapy itself. If you want to look into detail, visit the APA ethics page. There's a lot of really great explainers for the APA ethical standards that if you progress in your career as a psychologist, you're gonna become intimately familiar, whether you like it or not. It's gonna be at every point of your journey. So let's talk about animal research. This is something that's really near and dear to my heart, because I think that this is an area where the field really still has a lot of work to do. And most of the justification for animal research is that it's necessary for the treatment and for the application of treatment methods related to humans. But let's think about that concept that we are in a lot of cases causing undue or causing stress to animals for the purpose of research. Now, there are regulations for humane care and use of animals in research. First, that it must have clear and scientific or educational justification. The researchers must minimize pain and stress and suffering. Anesthesia is required when pain is anticipated. Species appropriate housing care and veterinary oversight has to be there. Only trained and qualified personnel may conduct procedures. That they're entitled to humane euthanasia when and that there's only approved methods used. Now, some of the strengths are that it recognizes some of the strengths of these guidelines, these standards for animal research, is that it recognizes animal welfare as ethically relevant. It prevents arbitrary or cruel experimentation. It creates accountability and external review. It improves scientific validity. Maybe there's a lot of evidence to suggest that animal research actually doesn't generalize to humans in so many cases. And so, in essence, we might be causing undue harm to animals for something that's actually not related to that doesn't have a clear benefit or clear justification for humans. Now, some of the ethical concerns is that animals are protected primarily when human benefit is expected. Pain is permitted if it's deemed scientifically necessary. There's greater protections for some animals than others, like mice, for example. And oversight can vary across institutions. Alternatives are encouraged, but not always required. So, part of a new development in animal research is that if there is an ethical or an alternative that doesn't involve animals, then you're encouraged to go in that direction, but you're not required in every case. So I'll it's hard for me to actually speak about this issue without being maybe somewhat biased, but I think that we use animals in research to an unhealthy and to a degree that we shouldn't and we don't need to. I think we cause, we're basically caging and taking away, we're caging an animal for life, and they're most likely going to die in that setting. There was recently an article that came out about the VA's use of beagle experimentation. So experimenting with beagle dogs on, to conduct research on different research methods, and there's an organization that tries to rescue those animals after they're involved with research, because usually the course of action is just to euthanize them. So I think this is going to continue to be an issue as we advance as a society, as we advance in psychological research, as we look at how to continually conduct more ethical studies. And so this is one I really wanted to highlight for you, because I think it's really, really important for you coming into the field in the future, for those of you that are, or even those of you that are doing research in any field or any capacity, to hopefully you'll think back on this lecture, and it'll provide some informative, provide some helpful information for you. All right, that's all we got for part 2. These are going to be posted on my YouTube channel. I'll provide the links and the announcements. Like I said, try to stick with these lecture videos. There's often a little bit of information that isn't in the slides as they're presented. You just get the information off the slides, and I hope to usually always provide a little bit more context for the how and the why. As always, send me some feedback. Let me know if this works for you. If it doesn't, if it's helpful to just have shorter videos that are digestible. Any and all feedback is welcome. So thank you all, and I will see you soon.